Child safety.
Because farms are homes as well as workplaces, they're a high-risk environment for children and young people. There's nothing more harrowing than a death or serious injury of a child. The safety of children must never be left to chance.
The safety of our children is very, very important to us, and that's why we put this area up. We want them to be safe and yet to be able to play, and we're aware that we're so near to the farm. My husband grew up on a farm and he's very aware, and he is a farmer and very aware of all the dangers, and we're living right beside it, and I just felt I couldn't let them out without worrying about them and having to be out with them all the time, and that's very difficult when you've other children and you want to get things done. And so we installed safe areas so that we could let them out and have freedom and yet be very safe. They know that this is the boundary and that's where they're meant to be, and they don't ask. Yeah. And sometimes I will go out cycling at the front of the house with them, but it's only when I'm with them, and they know that.
The safety of children must never be left to chance. Parents' responsibility. The predominant responsibility for ensuring the safety and health of children and young people rests with adults. All family members, farmers and spouses, and persons working on farms are required by law to do everything possible to ensure the safety and health of children and young people on farms. In the following analysis of fatal injuries, an adult was present where the majority of fatal injuries occurred, or the fatality could have been prevented by an intervention of an adult. Analysis of fatal injuries. An analysis of 41 fatal injuries in Ireland, both north and south, over a 6-year period from 1997 to 2002 showed the following. The majority of deaths were due to falling from or being crushed by tractors, trailers or machines, 55%. Drowning in slurry accounted for 17% of fatal injuries. Collapse of objects, such as walls or machines, accounted for 15% of deaths. The remaining 15% were due to falling trees, being kicked by an animal, fire and drowning. Most deaths occurred to children under 5 years old, 44%. 34% occurred to 6 to 10-year-olds, and 22% occurred to 11 to 16-year-olds. The majority of deaths can be prevented by ensuring that children are kept away from operating machinery, and by eliminating hazards like unfenced slurry pits or securing heavy objects like gates. 95% of childhood deaths could not be prevented by emergency hospital treatment. Therefore, putting effort into primary prevention is crucial to prevent childhood deaths. Code of Practice on Preventing Accidents to Children and Young Persons in Agriculture. A Code of Practice on Preventing Accidents to Children and Young Persons in Agriculture has been issued by the Health and Safety Authority. This gives authoritative guidance on securing safety of children and young persons on farms. The person in charge of the workplace must consider the safety and health of children when conducting a risk assessment. This assessment must include the following measures: knowing the requirements of the Code of Practice and complying with them, ensuring that a safe play area is available for young children. Children under 14 are not allowed to operate tractors or self-propelled equipment. Children over 14 will only be allowed to drive a tractor or self-propelled vehicle in line with the controls listed in the code, and where formal training is provided by a competent training provider. Children under the age of 14 should be prohibited from riding on tractors, agricultural machines or trailers. As an exception, children between the ages of 7 and 16 may ride on a tractor, provided that the tractor is fitted with a properly designed and fitted passenger seat, with seat belts inside a safety cab or frame. Access to all areas where there is a risk of drowning or suffocation must be prevented by secure fencing. Access to danger areas such as heights or entering enclosed pens for animals or fire traps are prevented.
International research indicates that children who attend a short course or who receive instruction on safety retain this information. They also share this knowledge with their parents, and this stimulates parents to improve safety on their farms.
A video and CD called Child Safe, Be Safe on the Farm has been sent to all national schools in rural areas. International research also shows that parents who know and understand the requirements for prevention of childhood injuries are far more likely to adopt adequate control measures compared to parents with limited knowledge.
I was on the bog bringing home turf with my brother and a worker, and it started to rain, and I was sitting on the back drawbar in out the rain, and my sleeve got caught in the stub of the power drive, and the coat got caught and was wrapped up in it.
So then I grabbed a Stanley knife and headed down to where the accident happened. And when I went there, I didn't know what to do. I didn't know where to start. I just met a hand of cutting the cloth off the shaft and picked up Brian and put him into the van and brought him back here to the house.
Well, I have a compound fracture up there in the upper part of my arm, where the bone came through my skin and it cut the ulnar nerve, which stops the nerves in your fingers, and it also affects the muscles. And I broke 2 bones down here and 2 here. My hands are very sensitive. I can't feel in my little finger, and if I put it near a hot surface and get burnt, I don't feel it. The muscles are very weak in it. I find it hard to grip anything like a pencil or a needle. And I've only got the power of my 2 fingers and my thumb. I used to be a good runner when I was young, and after the accident I lost a lot of training and I can't keep my balance properly. I was left-handed. I used to write with my left-handed, and I had to change everything. I had to change my writing to my right hand.
Well, I consider him, well, if you call it lucky, like, you know what I mean? He has his arm, although I suppose with limited use of it. At least he has 2 fingers and a thumb that he'll be able to use.